David Penberthy reached out to shake my hand as I walked in, and I subtly reminded him that we're in a new environment where that sort of thing is not acceptable behaviour. So it's all part of the COVID marshal testing as well. If you do the training course, you'll see that there are specific instructions and advice about that. COVID marshals aren't due to commence until Friday. So at this point in time, businesses who are required to have a COVID marshal on site will be going through that qualification process. Having done it myself, it's a relatively straightforward process which gives information to people who will have COVID marshal responsibilities so they understand what their role is, and we're hopeful that this will provide a visual reminder to people who are congregating in premises that there are still obligations about physical distancing and hygiene that will help us protect the South Australian community.
And what is their role?
Their role is to ensure that people are socially distancing when they're inside premises, that hygiene requirements are being adhered to, and that facilities are kept clean, and that sanitizer is available as well. So in essence, it is helping businesses comply with their obligations under their COVID safe plan or their COVID management plan, which means that they're able to continue operating while we're in this COVID-19 situation.
And what might the rules be changing?
Look, the current framework is that we are implementing the new direction, which has a significant impact on cross-border communities on Friday. It is being closely watched by Health, who advise us on the current situation. At this stage, we are moving forward with implementing that direction, but if we see positive signs from Victoria, particularly regional Western Victoria, then the considerations about what this direction means for those communities can be revisited. But at the moment, look, I would say at this point that people should prepare for that direction to be implemented on Friday. But it is no understatement to say that we are monitoring on a daily basis what's happening in Victoria and other states in terms of the impact it has on the health of South Australians. Anybody who's seeking an exemption for special circumstances must refer those exemptions to Health, and Health are making all of the decisions in relation to those exemptions. The considerations by Health, as I understand it, are based on the level of risk that a person is likely to present on their return. I can't comment on specific cases, but I would certainly encourage anyone who has exceptional circumstances to make contact with SA Health, get their advice and seek an exemption.
What about the health workers that now reported what subjects
Yes. I have spoken to SA Health about that particular matter, and I'm advised that the decision not to grant exemptions to those workers who live in Victoria are on the basis that their health services extend considerably into regional Victoria, which obviously potentially exposes them to the risk of COVID-19. And if they're moving between South Australia and Victoria, then that also increases the risk for South Australian residents. I'm also advised by Health that there are steps in place that provide health services to that community in the absence of those people in Victoria being able to come to South Australia.
So have all those workers
I'm not specifically aware of the status of any of those exemption applications, but Health would be able to provide that advice.
So the main concern there is that they tell them
Correct. The issue with cross-border communities is, whilst we understand that there are a number of families and professionals and workers who would do the right thing, we have no capacity to control people's activities who are Victorian residents living in Victoria who travel into South Australia for work purposes. And as difficult as these restrictions are on some of those families, and we appreciate those difficulties, we are certainly not blind to those. We are looking at the bigger picture in terms of public health in South Australia.
Some of these families, they have children that they now having to pull out of school, change schools and send them to a different one in Victoria completely, basically uproot this child's life. How can this be allowed to happen? Do you expect that families have to do that?
This is one of those difficult decisions that has been taken on the basis of health advice, and I think it's worth recalling or remembering that there are hundreds of thousands of students in Victoria at the moment who can't go to school. These people are Victorian residents and they are bound by the obligations of the Victorian government and their decisions. Our obligations are to South Australia, and as much as we try and accommodate people who live in those cross-border communities, at this point in time, with the activity of coronavirus in regional Victoria, the decision was made based on health advice that this was a step that we needed to take. We are hopeful that this is one of the very first things that we can relax as quickly as possible to minimise the impact on children who need to go to school. We recognise that education is vitally important, particularly the children doing Year 11 and Year 12, on the basis that they're doing SACE subjects. So there is an allowance for those children to continue their schooling so they can complete their schooling year.
How low will those numbers have to get for like?
We are advised by health in relation to what the level of comfort looks like. I'm not sure that there is a specific number. It's about where the disease is located, whether there's community transmission and the number of active cases. So I think there are a range of factors. It's not simply just one number that is the trigger. But we're hopeful that regional Victoria returns to the position it was in a few weeks ago, which means that we can relax this restriction and go back to, whilst it was not normal, go back to a more relaxed situation.
Isn't it correct that there are about 8 active cases in that region?
That's my understanding, that in the Glenelg Shire there are about 8 active cases, which is better than what it was a week or so ago, and we're obviously closely monitoring that.
That's too high.
We'll wait till health tell us what the threshold is that gives us the ability to relax that restriction.
Well, officers are meeting with
It's virtually a daily activity. We're meeting with health experts in relation to the directions that are in place and what steps are being considered in relation to protecting South Australians from COVID-19. The partnership between South Australian Police and Health has been very close since early March.
So what specifically are they discussing today?
I'm not part of that meeting. All of the directions are on the table virtually every single day. But the discussions also involve the activity of coronavirus in Victoria and other jurisdictions, and revisiting all of the decisions we've made on a daily basis to ensure that what level of restriction we have is appropriate for the level of risk.
Can you rule out a press conference later today to announce a change again to these cross-border communities?
I can't rule anything out. We do act very responsibly. We adapt very quickly based on health advice, but I wouldn't envisage at this point in time there is any change to the implementation of this direction on Friday.
When we have to be out for the residential
That's not something that's been specifically discussed at the moment. The residential cap was an outcome of discussions with SA Health that identified this as a measure that we could put in place to slow down the requirement to have to impose more significant restrictions on businesses in South Australia in terms of the number of people they can accommodate on premises. We know that businesses in SA have done it really hard over the last few months, and the current level of restrictions enable them to operate with some level of profitability. Any restrictions that saw a diminishing level of activity would be very hard on businesses. So the home cap, where people's behaviour is different in the home environment than it is in a controlled environment where we may have a COVID marshal. The cap will probably stay for some time at this point so that we can remind people that there is still risk in the community.
Back to the marshals, will they be expected to look out for things like handshakes and hugs, and if so, what should they do if they see one?
Well, they'll certainly be expected to look out for those sorts of behaviours which we know contribute to the spread of COVID-19. They have no authorities. This is about community engagement. It's about reminding people of their obligations. We're certainly encouraging COVID marshals to do that in a friendly and respectful way. And if there's any difficulties with patrons who refuse to comply, then the options for them are to bring on their manager or call police, and we'll be there to assist.
And what are the penalties for businesses and marshals being
COVID marshals are not subject to any penalty if they don't do their job, but the businesses who are obligated to have COVID marshals may be subject to a $5,000 expiation notice if they don't have a COVID marshal in place when they should have, and if the obligations of those responsibilities aren't being fulfilled.
And will every single business with a patronage of under 200, will be checked? What are the compliance checks? What will they
We'll be doing as we've done with all other restrictions we put in place. We have compliance teams that are visiting businesses. By and large, we're providing advice and education to those businesses that aren't complying at this point in time. We give them the opportunity to adapt to meet the requirements. We'll be doing the same thing with businesses as they introduce COVID marshals. We're there to support businesses and help the community prevent COVID-19 from spreading.
Is there concerns that the border communities that will be now forced to travel further into Victoria, some will have to travel 100 plus k's to do their groceries and go to essential services, that they will essentially be bringing the virus closer and it will be creeping closer to the border? Some of these people live only 4 kilometres from South Australia.
We've had to draw a line somewhere, and we've used the border of South Australia and Victoria. We have no capacity to manage the activities or movement of people who reside in Victoria, and our obligation is to the community of South Australia. We know that this is a significant impost on families and businesses in that cross-border community, and we're hopeful that we can lift this restriction as quickly as possible. Any body corporate is liable to a $5,000 fine, and individuals are liable to a $1,000 expiation notice. There's also an option of prosecuting people through the magistrates court, which see more substantial penalties. We're not taking an enforcement approach in this regard. Enforcement is kept for those people who blatantly disregard the directions that are currently in place to protect the community of South Australia. From the very beginning of this, South Australia Police has been working with the community. I'm very proud of the way police officers have been going about their duties, and I think most people we've had contact with have appreciated the way we've done that and the support we've provided. We'll continue to provide that support, but we will take action for people who just disregard the safety of South Australians.
Thanks, mate. There you go. Thanks, mate.
Sorry, one more. I don't have an update on that. Sorry.
Thanks, mate.
Thank you.
Thank you.